It's good to see you all again. My name's Dr. Siddiqui. I'm sure you guys have seen plenty of our videos so far. Good to be able to chat with all of you today. Thanks, Dr. Tahia Haq, for coming. How are you doing, Dr. Haq?
I'm good. Thanks for having me again. I am very excited to be here.
Yeah. I'm so glad that honestly this opportunity, this platform even exists, because I feel like, especially the topic that we plan to talk about today, which is, sexual violence, and especially in the context of an intimate partner relationship, is so important. And I feel that you, Dr. Haq, you can definitely talk about this more, but where I trained in DC, I saw so many Bangladeshi patients who had just kind of like just arrived to the US. They still hold on to, for better in many ways, to our cultural roots. So it was really nice to be able to identify with them. But then at the same time, there are many like subtle and overt things that were very challenging for me as a provider, but I'm sure if I were one of their family members, I also would feel this way too. And you trained in New York, right, Dr. Hawk?
Yes,
Yeah.
that's
And
so similar population. I did see a good amount of this, and I agree. It really touches your heart. You want to help as much as you can. And so that's why I think this platform will be very helpful and useful for us, for providers, and for everyone watching.
Yeah. One thing I definitely want to say, like before we even get started, Dr. Huck, like when you and I were brainstorming this, it was just interesting because I feel like in training, I don't know if this is like you, but in training, we just have to work so hard that we just totally get like desensitized to all of this. I feel like almost every other day, like a non-English speaking patient would say something about, I would discover that her pregnancy was due to rape or something. And I feel like it would just be information in one ear and out the other. And I think it's like opportunities like this that allow me, first of all, as a doctor, to really like digest and think, oh my God, এটা কি শুনলাম, but then also, be
Yeah,
able.
residency, you have kind of a lot thrown at you, and it can be a very kind of numbing experience because it's so much, it's so overwhelming for anyone's emotional capacity. It can cause a lot of burnout, but I agree, doing things like this, taking a step back to reflect and using our experiences, that's, I think, what helps us to move forward.
Yeah, for sure. And I was just thinking, especially in areas where this kind of stuff happens a lot, but like behind closed doors, I would just wonder what level of burnout those like people are feeling, having been subject to all of this. So it's definitely very tough. But do you want to go ahead and kind of like get us started in terms of like, defining intimate partner violence, and we can take it from there?
Yeah, so today we are talking about a very important topic. It's a very dark topic, but I am excited to talk about it because we need to shed more light on this as a community. So one of the kind of basic questions is, what is intimate partner violence? What does it look like? It's essentially when someone takes advantage, when someone exploits a relationship for their own gain, and doing so harms and hurts that other person. So ultimately, it's not respecting that individual, usually a woman, so not respecting that woman's emotional and physical sanctity.
Mm-hmm. So when you try to, like, for example, how would you explain this in like a cultural context to like your like Bangladeshi patient? And this is hard. Like, how can we, first of all, it's like hard for us to even define it in English. And এখন if like somebody says to like explain it in Bangla, it's so hard because in so many ways our culture has a lot of patriarchal roots. So like,
Yes.
what have you said in the past that has helped you?
For me, it's all about the survivor and what they're feeling. I agree. There's no really like one definition that can encompass what this is, but it's really comes down to the experience. How does this person feel? Are they always afraid? Are they afraid to speak up? Do they feel ashamed all the time? Do they feel like they are not able to do things that they want to do? Are they having difficulty and they're not getting the help that they need? It's very it is very subjective.
Yeah, it definitely is. And I honestly, I don't know if this was the right thing to do or not, because, when you're training as a doctor here, you kind of have to abide by all of the rules that kind of govern your entire being in a way. But so many times I would just to get answers to questions that would tell me if a patient of mine is in an abusive relationship or not. I would bring a clipboard with me, and the partner is almost always in the room, kind of overbearingly in the room. So
Yeah.
it's so challenging for me to say, and I'm sure you've experienced this, which is, I want to just talk to my patient. Do you mind stepping outside? That immediately creates a hostile environment. So I
Yeah.
have done things like bring a clipboard and pretend like I'm asking the patient to confirm her name and date of birth, but what I'm really doing is asking, has your partner hurt you? Or do you feel violated? It's tough. What do you do?
So it's hard. I mean, separating is very important when you're getting a history, because you're never going to get a clear history with the husband around.
Yeah.
Usually just saying that it is a formality, it is a routine for the individual to be interviewed separately. That's just part of hospital policy. So that kind of takes the personal factor out of it, because the husband might say, why are you separating me? What are you saying about me?
Wow.
So just say this is standard procedure.
Yeah. Yeah, that's really helpful. But where I think it gets really tough is if we were to talk to families about it, in which this kind of abusive nature is cyclical. Say if you were to give advice to your family member who is either being subject to this or knows someone, how do you advise? You kind of don't have a hospital to protect you. So what do you say? It's so hard.
Yeah, it's very hard. A lot of it in the beginning is listening, and this is something that we'll talk about. It's how to be an ally.
Mhm.
It's easy, and we talked about this a bit last time. The idea of giving advice versus listening. It's easy to give advice. It often, doesn't sit. But listening, empathizing, trying to understand what this person is going through, that's where you begin.
Yeah. Yeah. Can you give us any examples of times where that tactic worked or backfired? Either way, I feel like I've got a million for better.
Um, yeah, I mean, it's, in these situations, wording is very important. So oftentimes when I have a patient come in and says oh, I've noticed that, I've been feeling very upset, I've been feeling very down. And I ask are there any things that are triggers in these situations when you're feeling upset? And they said, oh, sometimes a fight with my husband. I'm oh, what does that look like? What does that fight look like?
I like that.
And then ultimately when you start to get a feel for it, and it sounds it sounds like there's a lot of yelling back and forth. Does it ever get physical? And just slowly kind of working your way up, and that kind of helps people to not feel like they're suddenly asked these intimate personal questions, but to slowly kind of walk them through it.
Yeah, yeah, I think that that's really helpful. And actually, this ties in very well to some of the things that we were planning to talk about afterwards, which is medically, what is the effect on the survivor? But actually, even before we get to that, we all know that this is a public health crisis. And I
Yes.
feel like I am not sure if calling it a public health crisis actually dignifies it more, or it actually in a way stigmatizes it, because I think people just continue to see it as a mental health issue. And you know how mental health is treated in Bangladesh or in South Asia, it's basically Jina Dhara. It's not really, it's taboo witchcraft, which is why I think, do you feel like this should be treated more as from the medical lens so that people can respect it more?
This is a medical issue. So yes, it should be treated like a medical situation. And yeah, there is a lot of stigma with psychiatry. This in particular, this is different because there are a lot of ramifications, not only for the survivor, but for families, for children. And like you said, this ends up becoming cyclical oftentimes.
Yeah.
And so that's kind of it's not just a crisis over the span of one time. It's a crisis over years and generations.
Yeah, it's tough. And also like I kind of struggle with when people try to like pinpoint you and ask you, well, demographically, which patients or which women are at most risk? I mean, the statistics tell you that women who, have lower education or lower socioeconomic status, but I feel like in our culture that that's not necessarily true. I think we see it everywhere. It just so happens that the women who are less educated, less are just less financially equipped, and so that's like another tool that their abuser uses to like subjugate them. So
Yes.
like what are your thoughts on that? Like what do you say when someone says that?
It is prevalent everywhere.
Right?
Everywhere. It really does not, it, it, it doesn't escape any group of people. It's across cultures, it's across religions, it's across people's socioeconomic background. And a lot of it is because of, like you said, kind of this kind of patriarchal society that we find ourselves living in. And so that notion is that's everywhere. And that's why.
Yeah. Yeah, it is. And I think I mean, we of course might be in over our heads in terms of like being able to dismantle it, but I think like starting here is obviously really helpful. So I want to go back to the medical side of things. Why don't you just kind of like hit the ball running? Like medically, how do you see it? I can obviously talk about the gynecological aspects, but medically, how do you best convince others that this is a medical issue?
So yeah, so this is a public health crisis. It is it worldwide. It occurs in about 30% of women in a physical or sexual form.
That we know of, right?
That we know of, exactly. And that number, if you think about it, is huge. 1 in 3 women. And if you think about all the women who are in our lives, who are supporting us, family, friends, colleagues, they essentially have a 1 in 3 chance of being affected. So think about all the women in your lives that you know, 1 in 3. And that's why this is important. And that's why this is an issue that affects everyone.
Mhm.
And there are a lot of medical implications for this. Um, it can The effect on the survivor, the effect on children, the effect on other family members. There are a whole host of medical syndromes that can and often do happen as a result of these cyclical abusive relationships.
Yeah.
And so it's hard to kind of characterize it and say like, oh, it's this one medical issue. It actually branches out to so many. It is
Mhm.
hard to keep track of.
Yeah. Can you speak more about like the effect on children? Because there's one thing that I feel like kind of like brings a lot of our patriarchal society together, which is like everything for the kids. I mean, especially here, I mean, our parents did everything to like maximize our opportunities. So a lot of times, whether our immediate loved ones were subject to some kind of abuse or not, the end goal was like এটা আমার মেয়ের জন্য ভালো, আমার ছেলের জন্য ভালো. Think about how many couples stay together for the kids. So
Yeah.
why don't like walk us through like what
Yeah.
effects it can have on children.
So it starts as early as in the womb. It increases the likelihood of a miscarriage, increases the likelihood of a stillbirth, preterm delivery, low birth weight in babies, and that's just with domestic violence that occurs during the pregnancy.
Yeah.
Afterwards, you have higher rates of infant and child mortality, higher rates of disease, diarrhea, malnutrition. And
Yeah.
then psychiatrically, you see a lot of long-term repercussions in terms of behavioral and emotional disturbances. And that can include a range of depression, anxiety, post-traumatic stress disorder, a whole host of issues that impact the children. I think that there is an idea that children don't fully understand what's going on. They're not really affected. That's not the case at all. Children are very perceptive. They pick up everything. Any sort of slight fluctuation in their parents' relationship, in their parents' like mood, emotional state, it affects them. And we see that in studies. It's an increase in their cortisol levels.
Yeah, 100%. And I mean, like, think about, I don't know if you had to do this. I didn't really have to do this too much, but I remember growing up, a lot of my peers had to translate for their parents, and think about like how much information they would end up, well, one, either getting from the doctor when the doctor and like my friend's mom had a conversation, or the things that were like that were forced to not be discussed. So I feel like you're totally right. I think also a lot of times, which is unfortunate, like children as they like age and become like teenagers, not adults yet, um, are like forced into these adult situations in terms of
Yeah.
having to pick between their parents, and that can be really tough. Like,
It's not only just having to pick between their parents. Oftentimes it's having to kind of be the parent for their mom, to
yeah,
help them when their mom is crying or when their mom has been beaten and is lying on the floor. They're kind of the ones that have to pick up the pieces oftentimes. And
yeah.
that can be very traumatizing.
Yeah. What are your, so it's tough because it's hard to find like psychiatric services for children. And I feel like these children, when they become adults, like unless they're streamlined into a process where they can get high quality therapy, it's almost like this is something that just goes by the wayside and they don't care about it until, honestly, they might have a, until like in the future when they have a midlife crisis, and then all of a sudden they start processing all of this.
Midlife crisis, or oftentimes when they find themselves in a relationship.
Yeah.
And they might find themselves yelling
Yeah.
at their partner, or they might find that they're with a partner who was like their father or like their abusive father. And so it's very difficult for these children who haven't processed what they're going through, what they've been through, because they don't have kind of the right support system. And then when they find themselves in a situation where they are being victimized or they are the ones who are perpetrating the abuse,
Mhm.
it is very it's very difficult for them to deal with, and they often deteriorate.
Yeah. Well, let me ask you this. So, one thing that you and I talked about also was the effect that all of this has on the abuser. And I think the way that I initially looked at it was that so many of our women, majority of our women, of our survivors are women, and they end up in a way justifying their partner's behaviors because it will, I don't want to make him more mad. He has to wake up early and he's the one who works. And, just this consistent justification for bad behavior. But is that like, what do you feel like is the effect on the abuser, other than the fact that having this person has a partner that's lenient when it comes to their bad behaviors? What else do you think happens with the abuser?
Essentially, it reinforces that this is an okay behavior, that this is okay for them in multiple situations. Usually, when this is how they're behaving with
Mhm.
their partner is not the only person involved.
Yeah.
Oftentimes it can happen at work for them, even with other family members, with friends. It tends to be a pervasive sort of personality trait. So all of these things sort of reinforce to the abuser that their behavior is okay in this world, that it's okay in this setting.
Yeah. Yeah. You know what I find? I mean, you hit it right on the head, but what another thing that I find very both fascinating and peculiar is that a lot of times like abusers don't look like the abusers, like the typical like caricatures that we have in our heads a lot of times, and it's like a psychopathic like manipulative tactic where they
Yes.
appear to be roses and butterflies in front of everyone, so that, but like at home it's completely different, so
Right.
that if you as the survivor were to ever speak out, literally everyone will gaslight you and think you're crazy because their partner is like this incredibly respected human being. So how do you, like, have you had situations with that, like where that is common, or how would you advise a survivor go through that when literally no one will believe her?
That's a very difficult question. It
It's,
has been like this for ages, for centuries. And that it really goes back to that patriarchal notion that men can do nothing wrong and the blame always falls on the women. And when they try to speak up, they're often shut down.
yeah.
It's difficult, and it really depends on the situation that the survivor is in. Um, the best thing to do would be to find allies and find support, people who will listen to them, people who will be able to speak out on behalf of them. And it can be tricky because they're in a dangerous situation, and speaking up can be even more endangering to their lives and the lives of their children. So it's really hard. It's hard to advise about.
Yeah, and and I mean, like, just going back to all of the like medical and from my perspective, the obstetrics and gynecological issues, I think so many times survivors, even if they like really want to in some way report their abusers, they love them, right? They do love them, and it's very difficult as you, the outsider, even if you're not their doctor, forget about that, but you as an outside well-wisher, to convince your loved one here that love is not pain. It is very difficult because, like, think about it honestly, like, as an obstetrician, I have seen, especially amongst like Bangladeshi women, I have seen the notion of internalizing the fact that motherhood is pain. So many of my patients come in with labor pain, but they refuse to get the epidural. Cano? Because no, as a mother, I have to experience pain. So think of like how ingrained that is in our culture. Like,
Motherhood, I was going to say womanhood.
yeah, I mean, yeah, definitely starting from womanhood, but I mean, motherhood, but I mean, like, it's just so sad because, like, other than the role of like, other than a matriarchal role, there are very few roles that women can have. So
Yeah,
it's just so like, pain is just a rite of passage, so to
right.
speak. So
Love is pain,
yeah,
right?
love is
Needing
pain.
love and affection from someone, that is painful.
How do we like in our, I guess, like, it's, I feel like it's easier. I know that this is obviously a pervasive issue here too, but I feel like these thoughts are easier for me to communicate in English, but like culturally, like, what do you think? And maybe I'm asking rhetorical questions, which I totally understand, but like, what do you think are like ways in which we can get our community to understand that, to not think of like, excuse me, like pain being intrinsically tied to womanhood, because that's what the root of all of this is, right?
Yeah, that's a good question.
It's hard because
It
um,
is.
when we were talking about this, we're like, well, so many of our female allies kind of buy into this too. That's how like extensive patriarchy is, that like your elders, your female elders that you look up to subscribe to the same like belief system. So
It's it's a unfortunately it's a process. Because we are ingrained these sorts of societies that we live in, there is kind of a level of, you can even call it brainwashing in terms of associating love with pain, and it takes a lot of years to reverse that.
yeah.
um, and a lot of people, a lot of women especially, have not experienced love without pain. So the question kind of you're asking is how do we help the community recognize something that they've never experienced?
Yeah.
And that's difficult. It's, you can talk about it and you can show them like, oh, this is what a healthy relationship looks like, but it's often a very foreign concept.
Yeah, it is. And I just think that like it unfortunately will probably require like years of therapy to unpack that kind of damage. And obviously like women in the like lovely women of Bangladesh can oftentimes have a tough time just affording like regular physical care, and then to try to afford mental health care, which, let's be honest, is kind of reserved for the 1% of Bangladesh. Like, it's not widely available. But কেন বাংলাদেশ কেন এখানেও তো, like, mental health is not primary care, even though it 100% should be. So
Yeah.
it's
I mean, and yeah, and in situations where, you know, someone is not able to have therapy, also, you know, these discussions that we're doing, these discussions that are going to lead to other discussions happening within circles of women, that also is helpful to slowly change the perceptions over time,
yeah.
because it's essentially how the sort of patriarchal society happened. It's the slowly changing of the mindset over time. So only through discussions and through literature reading will we be able to kind of turn that back into something a lot more positive than what it is now.
Yeah, it's I mean, obviously it takes a lot of like grassroots work, which I guess this technically is considered, but I think it's super important because, like I said before, it's like not, these issues end up being, in a way, like you see it more in women who are of like lower socioeconomic status, but that's only really because they just lack the financial like ability to be independent. But it's everywhere. I mean, so many of my patients, like, I'll give you an example. One of my patients in Virginia, she like Bangladeshi couple, but they had actually come here like 10 years earlier. So they were like relatively like well established. They both like worked, but like she would without fail, like every week of her third trimester, just come in with preterm contractions. And she has like no risk factors for delivering early. And so we have this like notion that, oh yeah, like domestic violence is associated with preterm birth because, you know, of course, like if you get assaulted, and of course I've seen that too, and that's like a very overt example of this. Yeah, if you get assaulted, then you start bleeding and then the like baby has issues. But this was like a really kind of like different way. And I remember talking to you about this before, just to like tell you how like insane these interactions could be. But yeah, she would come in every like couple of days, every week in her third trimester for preterm contractions. And then unfortunately, eventually she ended up delivering at like 35 weeks. And it sucks because then, just to clarify for everyone, 37 weeks is full term, and we generally don't like to deliver before 39 weeks. And this is a woman who unfortunately delivered at 35 weeks. Nothing other than the fact that she was so stressed out. So what had happened was that her husband had been wanting to file for divorce and got very or excuse me, she had wanted to file for divorce, but he essentially tried to like trap her in by making her get pregnant. So he would like track her cycles, and eventually she did get pregnant. And then like he would constantly stress her out about whether she was eating enough or like not exercising and making sure she stays in bed all day, which we do not recommend in pregnancy at all. To stay in like bed rest is not recommended unless indicated. And that like constant mental stress. So it's like he didn't even touch her, but like constant mental anguish like had her. I mean, of course she was going to start contracting preterm, and it'll only take that many contractions until she actually delivers. And it's unfortunate because like, of course, like the baby ended up in the NICU, thankfully, like not for too long, but it did. And so it's just, there's just so many ways. And it's like,
This is a perfect example of like, you know, people say, oh, well, like psychiatry, mental illness, oh, we can't see it. Do we know if it's really happening? It's like, that is a very clear cut medical situation.
yeah.
And yeah, we do see that, unfortunately, even though what the story that you're describing, even though it's very difficult even for me to listen to, the intimate partner violence does increase during pregnancy.
Yeah, because you're, in my mind, I would just think you're a slower and larger moving target. So I mean, it sounds ridiculous, but that's like what I understand. But psychologically, I like failed to put the psychological aspect together. I would just physically think, well, yeah, of course, he's going to optimize his opportunities to like, you know, assault because she's slower and just larger because she's pregnant. But no, just the psychological manipulation. Yeah, please talk a little bit more about it.
Yeah, so intimate partner violence always comes with manipulation, and that's manipulation and control. Control is oftentimes the central theme. Just like how you said, when he wanted to control her, he tried to get her pregnant, he tracked her cycles. Those are all examples. Um, there are many ways that the perpetrator can manipulate the feelings of a survivor, either through guilt, like kind of like you said, like, if you leave me, I'll be so sad. How can you do that to me? Through shame, your family would be so disappointed. You would be a bad mom. Through fear, if you question my authority, I will hurt you. So all of these ways are manipulations of feelings. And then there are manipulations of how women think, of their thought patterns. And this is also a part of that kind of patriarchal systemic brainwashing, that wives are subservient to their husbands, that men are the heads of the household, women's needs are not as important as a man's, that wives are obligated to have sex with their husbands when they want to. That wives essentially have to submit to whatever a man wants to in terms of control over her life and her body. And it can be, and it could be anywhere from just like mild forms of like very subtle manipulations that are hard even for physicians to identify, to very severe, extreme physical, sexual forms. And ultimately, all of this whole idea of control and manipulation, it ultimately leads to the degradation of a woman's soul, a degradation of their body, their sense of security, their sense of safety, their sense of worth. And also it can lead to a loss of their desire to live, which we do see in psychiatry. So many ramifications, so damaging to the woman. And it's just heartbreaking to see, kind of like in that example you gave us.
Yeah. I know that we were going to talk about it later, but since you did bring it up, talk to us a little bit about like marital rape. And I'll be super honest, I have lost count of how many adults who are grad school educated that I've met in the US that do not believe that that's the thing. Like they didn't even understand what that phrase is. So do you think you can, like, for the record, define it, and let's talk about it a little bit?
Yeah, marital rape. It is definitely a thing, and everyone should know about it. It essentially is non-consensual penetration perpetrated against a spouse. And so this is where consent becomes an issue. What is consent? Consent is important and irrelevant of the relationship status, irrelevant of whether it's a boyfriend, girlfriend, irrelevant whether it's a marriage. Consent is very important. So marital rape is any non-consensual penetration that is perpetrated anywhere, including in the house, outside of the house. Yeah.
Sorry, go ahead. What were you going to say something else?
Yeah, I was going to say, and I think it's really important to kind of talk more about this idea of consent and what it looks like, because one of the things that I've noticed is that men and women really don't know how to define consent. Like,
Yeah.
what is
Yeah. Well, do you think you can give us an example of what it very obviously does not look like? And let's like deconstruct that, because I feel like that's where I go to. I have these like golden examples of ways in which this is how I'm going to talk to my future kids, but I feel like it's ever evolving. So let's like, what's an example of like the absolutely not how to do it? And let's like go through it and how we can actually achieve like a good place where we can understand it.
So, I mean, a more common example that happens probably more in this country than in Bangladesh is with the use of substances. So when a woman is impaired, and they might not even be verbal, they might not be aware of what's happening around them.
Yeah.
even when women are sleeping. So that's not even in regards to substances, but they're just not awake.
Yeah.
Um, and if a man rapes that woman who doesn't have any decision making capacity at that time, that is a clear cut example of rape. And that includes marital rape. That can happen also in marriage. If the husband and wife have gone out for a night of drinking and the woman comes home and collapses and passes out,
Mhm.
and then if he rapes her, she is not aware of what's happening. And even though he may think like, oh, well, I'm married to her, so it doesn't count as rape. That's not it at all.
Yeah. So I'm glad you brought that up because I think that goes a lot along the lines of like date raping. And I know that that's like a bigger issue here, but you see the, like, you know, you see the youth in Bangladesh now, they have the access to the internet. Almost everyone's got a smartphone. So, I mean, like the kids are in Bangladesh and Dhaka, especially, like they're dating. And I mean, I wouldn't put it past them to kind of in many ways, like for better or for worse, to mirror like Western society. So I just feel like that, I mean, there's objectification of women everywhere. And like, and you can speak to this better than I can, but one thing I've always like took away from when I clearly saw a woman being objectified is that anytime a being is objectified, the risk of violence against that object increases because it's easy to like just toss an object when you don't give it any value. So that's it. Like it always stuck with me, and I feel like Western influence is so rampant now in South Asia that, and especially in Bangladesh, like it's going to happen, right? Like, I don't know if it's this conversation is just going to be between like aunties and us. It's going to happen. Yeah.
Yeah. Yeah. And that really goes back to the idea of women being less, women not being, for some reason, not being a people, humans, and instead being objects to be used, to be controlled.
Mhm.
Um, and yeah, and oftentimes they are seen that way. And that does certainly lead to abuse and rape.
Yeah, yeah. And it's like, especially the marital rape part, it's so, I mean, obviously like you and I understand, and many of our viewers also understand that it's a thing, but sometimes it's like goes beyond just understanding. Like, how would you counsel a loved one of yours who tells you, who confides you in you about this? Like, what steps would you recommend she take?
So the first thing is safety.
Mhm.
Safety is always the most important thing. Safety for themselves and safety for their kids.
Mhm.
It doesn't matter kind of where she is in terms of her desire to leave, desire for change in the relationship. Always think about safety, and we can go into that later as well. But it includes kind of finding safe spaces to go. It includes kind of preparing an emergency kit, so that if anything happens, there's kind of like a plan B, even a plan C.
Mhm.
So thinking about safety in the future is very important. That's the first thing I would advise.
Yeah. So I think I'm sorry, probably my fault, but we might have jumped the gun a little bit. But I know that we wanted to talk a little bit about like the five like steps, five or more steps, I think. And we start with pre-contemplation, contemplation, then determination, action. Do you want to quickly like run through them and we can talk about examples at each time?
Yeah, yeah. So the reason why this is important is because one of the goals of this talk is to show kind of what this looks like. How does this evolve over time?
Mhm.
Most people who get into a relationship, they aren't thinking like, oh, this is going to be a violent relationship or this is going to be an abusive relationship. And so it's important to understand that this can happen to anyone. And it can happen either very quickly or it can happen slowly over time. And sometimes we might not even recognize the changes in someone close to us, in a family member, in a friend. Um, and so, yeah, there are phases. So one of the phases is called pre-contemplation, and that just means that the the victim or the survivor is not really is not really thinking about it, is not actively aware of what's happening. And there's a lot of reasons for this. You mentioned before that there's kind of this rationalization that goes on, kind of like making excuses, like, oh, well, like there's so many what about the kids? I can't leave for the kids. Oh, well, he's not hurting the kids, so that's a reason to stay. So a lot of kind of, yeah, a lot of kind of, and it's a mindset. Pre-contemplation is a mindset. And it's the important thing to stress here is that oftentimes allies or people who think that they're being allies, they want to say, no, don't think this. You have to leave now. And that's not the case. This is a slow process. And this is something that takes time for women, and that is okay. And the goal is to support them no matter what stage they're in. So the way that I want to describe it is to viewers. So imagine either the current relationship you're in, or imagine yourself beginning a new relationship. As a new couple, you're building your lives together. There are a lot of structures surrounding that partnership, culturally, religiously, financially, with kids, family, social obligations. All these structures reinforce themselves and reinforce that partnership, whether it be a relationship or a marriage. And then slowly there are some changes, and these changes, these are the hardest parts. I think that the important thing to recognize is that on some very, very deep level, these women know, they know that they're not being respected. They know that they are potentially in harm's way, because there's an immediate kind of activation of fear in their bodies. And that is very hard to ignore. And oftentimes that kind of ends up being that voice in the back of their mind that they want to ignore, that voice that's saying that this is not okay, that this is not safe, this is not healthy for me or my kids. And it's hard to listen to that voice. And it's also hard because of all these structures in place, and especially if they're in a situation where no one is listening to them, where no one will take them seriously. If their husband is very reputable in their scene, and that's what makes it harder.
Well, what just to not play devil's advocate, but just obviously make this scenario harder for you. But what if I were to say, well, like Dr. Hawk, relationships are hard and we have to go through rough patches. So like, I find the most challenging thing is to try to help someone understand, someone who is at the place of wanting to understand what the difference is between a rough patch versus abuse. So how do you go about that?
So oftentimes it's cyclical. When someone is coming to you for the first time and saying like, oh, like a few days ago he did this, most likely that is not the first time, and that will not be the last time. And starting to help them recognize these patterns, because most of the time what happens is when something does happen, let's say that he got angry one night and he hit her, and then the next day he buys her flowers, he says, I'm so sorry, this will never happen again. And she's thinking like, okay, like this time he'll change, until the next time that happens. And so helping them to kind of recognize the pattern and recognize that these things don't just suddenly go away, essentially. And so that kind of leads into this idea that change, that emotional readiness in the woman, that change is very hard for them to face, because oftentimes they're afraid whether they'll admit it to themselves or not. They don't know what's going to happen. They don't know what their future is going to look like. If they're financially dependent, how are they going to provide for their kids? So all of these feelings are normal, and it is a very risky situation. And so that's just kind of an overview of how it starts, just the beginning of this cycle, of this evolution.
Yeah. And I just want to go back to the really strong point you made earlier about like what an ally truly looks like, because like you said, some allies like are just extremely like progressive minded about this and say, like the middle finger to everybody, just like go do you live your life. But they fail to realize that, okay, once this person completely divorces themselves from the whole situation, who in society will help her take the next steps? And that's really hard. Like nobody, a lot of times as much as we want to empower our survivors to get out of this relationship, we have to also remember that, okay, there's an outside world that she also now has to face. And like you said, if they're financially dependent on their abuser, like how is she in any way equipped to handle the outside? But the other thing, which I think is so sad and like really breaks my heart, is when a lot of times like female, especially in our culture, like female family members masquerade as allies by saying, no, like every relationship is tough. You don't think I went through this, so you should be able to go through. I went through this too, and look at all my beautiful kids and my family. You should be able to go through this too. It just happens. And I think that that's also like extremely like damaging. Like you said, it's just feeding into it more, and it's worse. It's like by the women in our families, but it's not their fault. It's the environment. So
Yeah, and it's the perpetuation of that trauma.
yeah.
And something I wanted to point out is people say like, oh, like just, you know, just leave him. It's really not that easy, because even though you've left him, he's still there. He's still around. He's still somewhere. And oftentimes it can lead to stalking. It can lead to legal issues where he's trying to take more of a hold of the kids, and then it becomes kind of this battle of who gets the kids. And so it sometimes these situations can just drag on and on. It's not just a matter of physically leaving. It's also hard to emotionally leave. Like you said, a lot of these women love their husbands, love them, and on some level they don't want to hurt them, they don't want to leave them, but at some point they recognize that it is important for them, for their safety, and for their children.
Yeah, yeah, that's like really really hard, because it's it's so, I mean, it's very easy for outsiders to just be like, this is very simple. Or even, you know what, even women who do possess the financial tools to leave, like who are healthcare literate and everything, have education. It's just like, well, think about what their world has now reduced to. Like their abuser has turned this big world that they used to live in, and now it's this little. Like this is how big it is. It's just literally him. So they've brainwashed them into believing that this is your world. Your degrees don't matter. This is your world. So it's like really difficult for them to get out of that, because that's not a world that they're used to. And that you were mentioning that earlier too.
Yeah,
Violence.
they'll say things like, you're pathetic, no one else will ever love you,
Yeah.
you're not capable of being on your own.
Yeah. Yeah. What do you have you ever had these situations where, I mean, I'm sure like now the youth in Bangladesh are experiencing this. Like if a girl were to have like sex out of wedlock, um, have you had encountered any situations in which like the partner of the girl that she was with sucks her into staying because, well, now that you know, now that you're no longer a virgin, who's going to like want you? And I think that that's such a huge thing in our culture, like the preservation of virginity. And I'm not trying to like downplay it at all. I totally understand why it's important to so many of us, but just using that as like a manipulative tactic to kind of enforce like exactly how much worth that you have.
Yeah, that goes into the shaming.
Yeah, like it clearly goes into like the slut shaming, but even outside of that, it's like so difficult because just one sexual encounter can in some ways like brand some of these women.
Yeah, and it is important to the culture, but we need to kind of be able to separate when the culture condones this sort of behavior and
Yeah,
supports the behavior, um, and when it really should not.
right. I feel like the critics of, I mean, I guess what we're saying right now would say something like, well, then do you want a very just sexually promiscuous society? Is that what you are advocating for? Which is obviously not the case. Being sexually promiscuous also like has its due dangers as well. But like, what would you say to them? And I find this very difficult because I feel like they take a very polarizing stance here.
Well, first off, I would say no woman should be forced into doing anything that they are not comfortable with, and that includes marriage, that includes a relationship, period, no
Yeah,
matter for what reason.
yeah,
Um, yeah, I agree. It's hard to
yeah.
it's hard to figure out what to say.
Yeah, yeah, it is. And I think, I mean, and it's just because so many of us are like, brainwashed into believing that like the preservation of virginity like equally translates to your or is tied to your self-worth. So
and you could probably also speak to this concept of virginity and the hymen
yeah.
and
Yeah, I mean, I'll be really honest. What I tell my patients, Bangladeshi or not, actually, especially emphasize it to my Bangladeshi patients, is that virginity is a social construct. I'm going to say it. That's what it is. It's completely, there is not a virginity bell down there that you can ring. I promise you, I'm a gynecologist. There just isn't. So it clearly is like a social construct that was used to manipulate physically and more so or worse emotionally women, chastising them for behaviors that like men engage in and only because it's just not ladylike, or also worse, like trying to convince a woman that like losing her virginity is like a health risk for her. No, it's not. A lot of times people like to think that, of the hymen being torn as like immediately that means she's not a virgin. There's so many ways the hymen can get torn. You and I both know that. Like so many ways, for the record, everyone, many, many ways. But even aside from that, even if like your hymen was torn just through intercourse, that has no bearing. Like virginity does not exist. That's not a real thing. It's just you either had sexual intercourse or you didn't. And those are the only two categories. There should not be any like value attached to them. I'm sorry for like getting emotional about this, but I get really upset because so many of my patients come to me and they say, well, like, especially my younger patients, like the 16-year-olds, because they've lost their virginity, they are just nervous that like no other man in the future will want to be with them. And it's outlandish, it's crazy, and it's very frustrating. It's very frustrating when you see your patient and she's convinced of this and you only have an hour to see her as your doctor, so you can't really do much. But
and that's part of the, they are on some level brainwashed throughout their whole lives to believe this concept.
Yeah.
So how can you in an hour kind of undo all of that? It's almost impossible. And unfortunately we have to just be in roles where we can be supportive. But there's not much more that we could do in those situations.
Yeah, it's just there's so many ways that like sexual abuse, like whether it involves like non-consensual penetration or not, but just like using a woman's sexuality to like manipulate her is so challenging. Like in my line of work that I exclusively focus on right now, which is pelvic surgery, there's so many times like women come to me and they honestly very physically on their exam have nothing that is out of the like norm. Everything is honestly normal. However, they have a partner who's told them that you don't look right down there, therefore I will not sleep with you. And they feel like, honestly, they feel like damaged goods. And I just feel terrible because I'm objectively telling them as a doctor that you look the same as every other woman with this architecture, this anatomical architecture.
It damages their sense of worth, their sense of self. Yeah.
Right?
Yeah.
Yeah. And it's really like, it's really tough.
Yeah.
Sorry.
And
Yeah.
that's kind of the idea. The sexuality is and is supposed to be an enjoyable experience, and it ends up being completely the opposite.
Yeah.
We demonize it.
Right, right. And I think that I know that us talking about child marriage is out of the scope of our talk today. And we hope maybe in the future we can revisit it. But like so many women in Bangladesh do get married young, and they do get married like virginal, so to speak, as in they've never had penetrative intercourse before. And again, the theme of like love is pain. Like if you, of course this is going to be the first time you're having intercourse, yeah, like be prepared to be in like excruciating agony, and that's part of your rite of passage. It's wild. It's not
Yeah.
okay.
It's
I
not,
don't know what else to say.
it's not okay. And we are going to repeat that as many times as we need to
Yeah,
during the session.
like not okay. Not okay. Sorry, Dr. Hawk, I know like I'm sort of derailing us, but we talked about the pre-contemplation and we talked a little bit about contemplation. Do you want to like make sure that you hit all of the points you wanted to hit?
Yeah, so I kind of want to talk about, I mean, and this kind of goes back to like, what does it look like? Like, what does it feel like? And how can we look for it in the people that we love and our friends and our family members?
Right.
And so once a woman gets to a period where they recognize that there is something very off, but they're probably not ready to make any changes. So I think a good question is, what do they do? What can they do at that point? And at that point, it's a lot about kind of observing and watching. So the
Mhm.
first thing I say is observe kind of yourself, your inner space, your inner world. And that's a hard thing to say because some people, a lot of women don't even feel like they're allowed to have emotions or allowed to express their emotions.
Yeah.
And so we live in a world that is so often dismissive of our feelings, of women's feelings. And as a psychiatrist, as a therapist, I stress this so many times. Feelings are there to tell us something. There are minds in our bodies signaling to us that we're happy, this is good, or we're not happy, we're sad, this is bad, we're afraid. So if you find yourself kind of persistently or frequently afraid or scared of your partner, that is a sign. And that could be emotionally afraid, maybe afraid to speak up, or physically afraid that he's going to do something to your body. And so that's kind of the first sign to look for.
Mhm.
And then there's kind of observing your partner, observing your husband. How does he act towards you? How does he speak with you? People often think that abuse is physical. It actually is a whole psychological manipulation, like what we've been talking to, that often includes physical manifestation, but it's really kind of that beating down, the degradation of a woman's soul. And so how does he do that? So I mean, there's so many examples of what we call this sort of verbal abuse, and it's all in the language. So I think the most common example is a husband is coming home from work and he's tired. Something bad happened at work. He got into an argument with someone. And he comes home and he's immediately like, why don't you have dinner ready? Why isn't it ready? Why isn't anything done? Why are you talking so much to me? I just want to come home and relax. I've worked so hard all day and you do nothing. So
Mhm.
kind of like saying that they are worth, implying that they are worth so much more,
Mhm.
criticizing them, that high level of contempt, that anger. And
Mhm.
we actually call that like an acting out, a displacement of their anger or frustration, whatever negative emotions they were not able to handle during the day, oftentimes taking it out on the people who are the most vulnerable. And that's where the wives and the children come in.
What would you, so one thing that I've noticed and I struggle with is that a lot of like women who've had partners like this, who've like overcome these kinds of situations, mainly by just like writing it because, who's going to listen to them? And like oftentimes these like female elders that we come to like respect so much because we say, oh, she's gone through so much, but look where she is. Like, what are your thoughts on that? Because she kind of like internalized all of this violence and yet still made it to where she is, which is wonderful, excellent, and amazing. But clearly she did so at the expense of her mental health. And now, should this be something that we should be very clear and upfront about and say, we respect you for everything that you've done, but are you okay? Like, think of like how much mental anguish you went through to get there, because chances are it's these like women who then end up feeding back into the system. So when like younger women like us go up to them and tell them about our issues with our partners, they kind of say, I made it through, look, there is light at the end of the tunnel, ride it. What do you
So
say?
So that is a sign of someone who is not a good ally in that situation. And I'm sure that these women are very wise. They have gone through so much. Um, but that is not a good ally. To that's considered very dismissive, to say like, oh, I went through it, you'll be fine, go through it too.
Mhm.
Instead, an ally would say, well, let me hear. I can't believe you're going through something so difficult. Tell me more about it. I'm so sorry that you have to go through these.
Mhm.
Those are kind of the words of what an ally would say.
Yeah, yeah, that's like really important. And again, I mean, we can talk literally all night about what a true ally is in our culture, but I think like clearly the cornerstone is listen, like listen first, react later, at the very least. Um,
Empathize, understand what they're going through, where they're coming from,
yeah,
and validate
yeah.
whatever it is that they're feeling. It's okay to feel that way.
Yeah. I think the empathy part is like definitely a double-edged sword here because so many times, like the women in our society, they empathize because they literally can relate.
Yeah.
But again, because they feel like they've overcome it, they've emerged victorious from the situation, they feel like everybody else can too. And that's, like, of course,
So
not the case.
yes, and that really goes back to kind of the cycle of trauma.
Mhm.
And the goal, the way that I think of it, the goal of humanity is to decrease that trauma and that burden each generation, each successive generation. So
Yeah.
here we are, you and me, we're talking about this in such a different way than our ancestors, than our grandmothers would talk about this. And that's kind of how we're starting to break out of this cycle.
Yeah, no, that's really important. And actually, your mention of trauma reminded me of another example, and it goes back to like how much like the verbal aspect, how important that is. I remember I've had a couple of patients who, and it's striking the fact that a couple of patients have told me this, but they actually, and this might sound crazy, but they would say that they prefer the physical violence from their partner rather than the emotional torture because physical violence gives you the kind of pain that you can quantify. And
Yeah.
it's like, this is quantifiable pain. So for this pain, I can take this number of Tylenol or ibuprofen or pain medication. Whereas, like for mental anguish, that's not quantifiable. Like you have to struggle to even get others to believe it exists.
Yeah.
So it's, and it goes back to like why people like do things like cutting, right? Because it's like in really, it's an emotional release. Like nobody actually enjoys pain, but it's like an emotional release of all of that, like that anguish. So yeah, that's it's striking how many times I've heard that.
Yeah.
And yeah, it just speaks to the fact that it's like all verbal, like physical, the physical consequence is like the last thing that happens, right? Like,
Yeah, yeah, and that kind of goes into the idea that, oh, like the physical pain is a part of this. That's a part of my life,
yeah,
um, and it's something that is more tangible, something that they're able to understand more than the emotional side.
yeah,
Yeah,
that's also important. Like being able to understand it. Like you can talk to your doctor about like you fell and now you're in pain, so you need XYZ pain medications, and it's like wildly different to have to explain to them like emotionally what your trauma is.
exactly. And so that brings us to an important topic of emotional abuse. What does emotional abuse look like?
Yeah, yeah,
It A lot of people often don't know, and it's interesting because it's so prevalent. It is so it's so prevalent, and it's kind of exactly what we've been talking about, this kind of slow degradation of a woman's ego. um, and it can look like a lot of things. Oftentimes the perpetrator can be very obsessive, so
mhm,
they can be very jealous or upset if the survivor spends time away from him.
yeah.
And that's where that control comes from. He wants complete control over her, and that includes her time.
Mhm.
um, that sort of yelling, blaming, ordering her around, saying, oh, do this, make me food, pick this up, and then insulting, telling you you're worthless, saying that no one will ever love you, and this kind of possessiveness. So cutting you off from your family or friends, kind of trying to separate you from people who would be allies or could be allies. And then it's oftentimes just kind of this controlling of your time, like preventing you from going to work or preventing you from getting an education, from going to school, which is very important, more important in Bangladesh than it is here, where school is mandatory for everyone up until a certain point.
Yeah. Yeah.
And then, and then a type of emotional abuse is the controlling of decisions, preventing you from making decisions for yourself. And sometimes that can be as small as, I don't want you to wear that.
Yeah.
I don't want you to go out looking like this. Um, let's say like you want to meet up with friends. No, I don't want you to do that. So just kind of like that, not taking away your decision-making capacity, essentially. And
It's interesting that like it's not even just I don't want you to do this. Actually, I feel like in my experience, I'm sure you've dealt with this way more than I have or in a different capacity, but I feel like so many times that it's like more insidious than that. It's not even them directly saying I don't want you to hang out with your sister. It's instead don't you remember what your sister said about you? Like, why would you want to hang out with her? And it's like things like that. But then you slowly start to notice that like it's everything like, oh, your male coworker is throwing a Christmas party. Why would you want to go there? Like you don't need to be there. It's things like that. It's like sometimes I wish they would just outright say, I don't want you to do this so that we can have that kind of stuff for the record. But they usually say these like masquerading like pleasantries instead.
like, oh, that's what you're wearing.
Yeah, right. Like that's a good one. Oh, that's what you're wearing. Like this looks better for your body. I don't want people to look at you. I don't want people to look at like my woman. And it's
Or even like, oh, that's a lot of food on your plate.
oh yeah, yes. That's like I feel like that is really tough in our culture because I just feel like on the one hand you have your moms who like will like, you know, throw themselves in the crossfire because they feel like you are too skinny and like they will die for you, you know? But then you have like partners who just say, whether they're influenced by Western or Bollywood media or not, they like see you eating. It's almost like eating is something that you have to do in private.
Yeah. Or even like something as simple as putting makeup on.
Yeah.
Why do you look different? Why do you look like that? Who are you trying to impress?
So I'm so glad that you brought that up because this is one thing that I thought of earlier that I wanted to ask. So like this was back when we were talking about consent. So it's so interesting. Like obviously, well, for the most part, I don't want to speak for all of our viewers, but for the most part, like boys when they're going through puberty they're not really like given any kind of sex talk. None of us really are, let's be honest. But for the boys amongst those who even get the sex talk, it's just something like do not have sex, definitely do not rape, you know. I feel like for girls it's not even do not have sex, it's do not have sex and do not give anyone reason to have sex with you. I think it's so much of that, like so much of that. And I understand that it comes from like a place of wanting to protect your young, because sometimes I think about it and I'm just like waffling in between wanting to let my daughter like live free versus wanting to like just raise my daughter in my like studio apartment. You know, it's just, it's tough because I feel like that's like kind of the narrative that we keep getting, which is don't have sex, don't even think about it, and do not let anyone even
It's
consider the
it's
idea.
it's a part of this like it's a part this idea is like a part of this society of blaming the victim blaming
Right.
essentially. And so like it's like one thing that I want to make very clear is there is a difference between thinking that someone is asking for it and someone actually verbally asking for it.
Mhm.
If you are thinking that someone is asking for sex, that is not consent. What you think does not matter in consent.
Yeah.
Consent is a woman verbally giving consent.
Yeah.
Even if you think they're giving consent, that is not consent. And
Yeah.
consent does not happen with clothes. It doesn't happen with the way you dress. It you could be wearing anything. It's not about that. It really isn't. And the fact that the society continues to say that, oh well, she got what she was asking for because of what she's wearing. How can she go around looking like that and thinking that that won't happen to her?
Yeah, I'm really glad that you brought that up, that like obviously it has nothing to do with who you are and like what you're wearing, because like think about how much violence there is against sex workers in Bangladesh, right? Like their job is in like in the sex industry, but does that mean that if they are never allowed to cry rape? I feel like they're probably experiencing rape in like record high numbers, but it's not ever being recorded because, you know, they're sex workers. So you can't call it rape, you call it their job, which is so terrible. Like, doesn't that sound terrible? But you've heard it, right?
It sounds terrible. I've heard it. And the crazy thing is that's kind of what
I feel like I'm gonna cry. It's crazy. This is crazy.
I know. And
Yeah.
the thing that's crazier is that a lot of people think about this in terms of marriage. And
Mhm.
that's where marital rape comes in. It's like, oh, well, this is your job as a wife.
Yeah.
You can't say no.
Right. It's so crazy that I feel like your manifest destiny and like everything that you're supposed to be as a woman is so like just written in like ways that it's just like incomprehensible to like us, right? But this is like real life. This is totally real life. It's frustrating. I'm sorry. I'm clearly like maybe I'm not right for this. I'm just obviously very emotional, but it's like it's so important.
It's so important. It's so important. And I honestly, and this is an important point to remind viewers that this is a very hard topic. This is hard for anyone to listen to, anyone to talk about. So, for people out there watching this, if you find yourself feeling upset, it's okay to pause. It's okay to take a deep breath. It's okay to take a break and come back. It's all normal. This is all.
Sorry, guys. We should have actually said this earlier because otherwise then I might have even controlled my my emotions a little better too. But I mean, you know, it just goes to show you like how important this is and it affects everybody. Um, so yeah. So we were Dr. Huck, we were talking about like action and like steps to take. So it's like pretty different, right? Like in the US, like honestly, I thank my parents for coming here because if I was, oh my God, stuck for life, if I was ever in a situation like this, I think like you and I would at least like know where to go. What do you, what have you come across it like in your research in terms of like places that like our Bangladeshi women can go to in Dhaka? It's hard. It's really hard.
It's hard. Mainly what I've come across is a call for resources.
Mhm.
Um, because I think everyone in some level recognizes that there is a huge deficit in this area and there's a huge need for it. So we do need resources. We do need shelters in Bangladesh.
Yeah.
These women should be supported. Oftentimes there is nowhere for them to go, and it's difficult for us during this talk to say find somewhere safe to go.
Right.
But where is that for a lot of these women in Bangladesh? Sometimes it's even hard in places in this country, rural areas in this country, who may not have the funding for shelters and for support like this.
Yeah.
So it's a problem everywhere.
Yeah, for sure. I really think it is. And I feel like in places like in Dhaka or other big cities in Bangladesh, that like the only places that you can go are either to the police station or to the emergency room. So like think about, I mean, you and I have both worked in the emergency room. Think about like the most common like chief complaint or symptom that somebody who you find out later was actually is just in this like cyclical abusive relationship that they're just trying to flee from. What are like the main things that they come in for? Probably like some upset stomach or very non-specific symptoms, right? But once they come in, they like find so much like solace in you and you're a stranger to them. I feel like those are signs, but it's sad to think that like your only options are to go to the police station or to a doctor. But with that said, I mean, I don't want to, I know that a lot of times like Bangladeshi women have had a difficult time navigating the healthcare system in Bangladesh, especially with some doctors who might not understand their like cultural like situations too well. But I don't want to speak for all of them. So I think it is really important for us to empower our viewers and say, like, if you do go to a doctor, be sure to tell them exactly what's going on. And the more you say it, the more someone who actually values you and cares about you will take it seriously. That's, I mean, you
And
might
it,
cost yourself by doing that, but
And
it's
it's the same idea of recognizing who an ally is. And it's kind of like you said, like there are some doctors who are not allies, who
right, right.
who and that a part is that's a failure of their training and a failure in their ability to communicate with patients. And it's important to recognize that that is not a failure in you. That doesn't mean that that your notion that your feelings are wrong, that oh, like you should just not think about it and dismiss it. There are allies out there. It's just a matter of finding them, and it's a matter of recognizing who they are, how they're speaking to you.
Yeah.
And we want to say, and we hope that doctors are allies, but it's also important to recognize that some are not.
Yeah. My understanding, I guess, of a doctor who is an ally is someone who will listen to you and understands that even though he or she has a time constraint because there are a lot of other patients waiting, but lets you do more of the talking. Because I feel like a lot of this is purely, it should be like survivor narrative driven. I think a lot of times, and this is something that doctors even in the US get dinged for, which is like, I think the record for a doctor, or not the record, but the average time a doctor allows a patient to speak before interrupting is like 7 seconds, which is really, really not good, not okay. And I'm sure it's worse in places like Bangladesh where the like population density is so high, but that's what it looks like someone who will like listen without interruption and without, yeah, I think that's a good place to start.
And unfortunately, oftentimes that doesn't happen. And yeah, I completely agree with what you said. It is about the woman's narrative. That is the main focus. And no one should tell you that your narrative is wrong, or like, oh, like you're just overthinking things, or like, oh, you're just being hysterical. All of those things. If anyone is telling you that, that is not okay.
Yeah,
And that is not an ally. Your narrative is unique to you, and no one can change your narrative for yourself. And that's something that's important to stress, because a part of this whole brainwashing by the perpetrator, by the society, is to make you feel small, to make you feel like you don't have a space, that your emotions are wrong, or like are just like are you, or you're just like faking it,
yeah, yeah.
or like it's imagined. Oh, like it's
Or
all in my head, like yeah. And
yeah,
so and so and that's the thing. And it's hard when you have so many forces working against you. It's hard for you as a person to speak up about your narrative and project that to other people and say, this is wrong, this is what I'm going through. And that's what the hope is that with a talk like this, we are able to help people watching this find their voice, or even help people watching this help their family members, help their friends find their voice.
yeah,
And helping to find someone's voice is all about listening.
yeah.
And that's what doctors should do. That's what allies should do.
Yeah, no, I love that. That is you so beautifully put it. I love that. And I just like can't help but like think about our like the young moms who, and in our culture, it's sort of like ingrained a lot of times when like younger bride, not even younger brides, really any age, when they get married to their spouse, they like move in, so then they become part of their new family. So think about it, like they're like literally leaving their own family, and maybe in their own family it was just their mother that she can talk to, leaving that behind and like moving in with a whole new family. And their expectations might just mirror their spouse's expectations, so it's like really tough. It's so isolating. I think just that itself is isolating, and then on top of that we add on abuse. That's like way worse. Yeah,
That is, and that also touches upon like child marriages,
yeah,
child brides, and something I wanted to bring up before is this idea, this kind of old notion of marriage as like a transfer of property,
yeah.
and that's kind of where this objectification is kind of solidified. That oh, like well, like now you belong to me, now you belong to our family.
Yeah,
Um, and that just kind of perpetuates this this notion that women are objects, that they are there for their husband to use at their will.
Yeah, yeah. And it's so unfortunate because like I think you and I touched on this a little earlier, but like the idea of a prenuptial agreement, like obviously nobody likes to think about that. Everyone wants to think about the marriage that they're entering as being like the lifelong, but we know that things happen. I can just imagine like the social ramifications like for a woman to ask for that in this kind of society, and I think that that's really challenging. I honestly don't know of any woman who has asked for it.
So historically, the legal system in any country
Mhm.
has failed women in this aspect.
Mhm.
They have not been able to support women in these relationships,
Yeah,
in these notions of pain and violence.
yeah,
It often these legal systems are set up by men and supported by men, and women are barely thought about.
yeah.
So it is a huge failure of the legal system around the world.
I'm sorry. I feel like we might have digressed a lot, but well, we talked about action and any other things that we.
Yeah. So we've talked kind of about the what you're observing in your partner, the signs of verbal abuse, signs of emotional abuse. And these are what I like to call red flags. They're little kind of markers that go up in the back of your mind. It's like, wait a minute, this is not okay.
Mhm.
And they escalate over time. And sometimes they don't, but oftentimes they do. And it's important to keep an eye on that and to observe that.
Yeah.
So, you're in a situation where there's a lot of obsessiveness, possessiveness, yelling, blaming, and then it can even turn to
Yeah.
threatening to hurt you, threatening to withhold money,
Mhm.
threatening to take away your kids.
Mhm.
And that is kind of reinforcing that fear.
Yeah.
Um, and then ultimately, it can even be as bad as threatening to kill the victim, threatening to kill the children, or even threatening to kill themselves. Perpetrators will often say, if you leave me, I'll kill myself.
Yeah. That's really hard because I just feel like I don't know, how do you handle that? Because I think that that definitely is what like sucks so many survivors in, because they definitely don't want to be the cause of someone else's death. Um, how have you like counseled when something like this came up?
It's
'Cause-
really hard, and this is kind of we get in when we get into the idea that as a physician, as a provider, we are not we're not telling our patients to leave, because
Mhm.
oftentimes they are in these dangerous situations where there he could be saying like, oh well, if you leave, I'll hurt the kids.
Yeah,
So
yeah.
that's where kind of our role is. We have to be very careful with what we're saying.
Yeah.
Um, and it oftentimes is based on kind of the woman's comfort level.
Mhm.
And if she feels that she is in a safe situation, a safe enough situation to leave. And we'll get into that a little bit later about kind of what that safety looks like.
Mhm.
But one thing that I want to kind of go into is, so now that we've gotten to kind of this escalation of verbal and emotional abuse that leads to threatening, then this takes us to the physical abuse, the sexual abuse. Oftentimes, the first type of this abuse is physical, and this can happen anywhere. We call this kind of domestic abuse, but like this happens inside and outside of the home. And oftentimes it's this violence, this choking,
Yeah.
beating, hitting, punching, bruising, breaking bones. I'm sure you've seen these.
Yeah.
And in extreme cases, although not that rare in Bangladesh, you have acid throwing.
Yeah.
General.
Yeah, yeah, that's acid throwing in general. Like another thing that still happens, and this is so sad, but like when a woman is pregnant or after she delivers, um, giving birth to a girl and not like bearing a son. And that I think can end up being so difficult. And I know that this happens in some like Indian cultures too, in some Indian cultures, but I would not be surprised if it happens in Bangladeshi culture as well. But like a lot of times if you have a boy, if you like give your husband a son, then you are given like gold as jewelry, as like appreciation for all of your efforts in bringing this like son, this male child into the world. Whereas for females, it's almost like unequivocally seen as like a little bit of a burden. So even when you like are literally procreating, you still for some reason have some sort of
So,
responsibility that's not.
so Dr. Siddiqui, let me ask you, how much control does a woman have over the gender of their child?
So literally 0%. So just saying, and actually, if we're going to be really technical, it is the male that determines the sex, based on the chromosome that is donated, and that's beyond the scope of this. But like it's literally 0%. But it's wild how many times like it's the woman that's like
Blame.
or blamed and abused for it. And I remember one like specific example from residency, and this was not a Bangladeshi couple, but honestly, like it was a Nigerian couple, but they had like strikingly very similar cultural practices as we do. And unfortunately, the my patient delivered a stillborn, and it was very sad. It was a very sad situation. None of us expected it. Actually, wasn't the baby was not stillborn. Baby was born alive, but then shortly after passed away. It was a very, very tough situation. But I promise you, the absolute hardest part of that was like watching the father of the baby berate his wife in front of all of the providers because she killed his son. You killed my son. You are bad luck. And it's like such a, even though, I mean, obviously, like, this is not a culture that we know, but it's so crazy how we can easily identify because it could have happened in our culture too. Like think about all of the women in rural parts of Bangladesh who still deliver at home. And, you know, it's like it's very it's alarming that we still hear this. And it's, you know.
On oftentimes what this really comes down to is this kind of poor emotional capacity of these types of men
Mhm.
to be able to contain their anger or their frustration or their sadness and just kind of immediately shifting it onto the woman.
Yeah.
And it's so common, and and in part it's so reinforced by society that this is okay. And it's so sad to see. It's so sad.
Yeah. Yeah. I actually don't know how much like what percentage of like Bangladeshi, and maybe you know this, of Bangladeshi women suffer, or Bangladeshi women we've lost to honor killings. I know that this is something that does happen in Pakistan a lot. And I know it happens, like, I don't want to just say Pakistan, it does happen everywhere. I just don't know the prevalence of it in Bangladesh. But isn't that also crazy? I mean,
I just I can't.
yeah.
I mean, the thing is like these difficult concepts we're laughing about because we can't even. It's like it's impossible to wrap your mind around. It's like how is this okay? How is this happening? And how is this possible? I just
Yeah.
it's it's not okay. I think that is a common thread of these
Our
discussions.
hashtag, it's not okay. Yeah, yeah, it's really tough because I know that you and I, again, like think about our privilege. I'm sitting in this like fancy apartment complex and clearly very easily being able to be riled up about this. But if we lived in that society, we probably wouldn't even be able to say this kind of stuff. Otherwise we'd like risk losing our jobs at the minimum, right? So I just like it must be very, very challenging for those who are truly, and this is the first time I'm going to say this word because throughout, viewers, we've been saying survivors, but truly in these situations, you do end up literally being victimized when you have no idea how to move, like when the abuse makes you inert. And
Yeah.
it's, yeah.
Yeah.
Yeah. So I think I feel like we've covered a lot of ground here. What other, and I know that honestly, Dr. Hawk, we can probably stay up all night, and I promise you a night we will do that. But anything that like really strikes out to you right now?
I mean, I think the thing that I want to say and to summarize is it, even if you're not ready for change, try you can still be active in this.
Yeah.
You can try to understand your situation, understand what's happening around you. Watch out for what I call red flags, and see kind of the pattern of escalation. And one of the things that is important to explain is that be aware of your surroundings. Are there weapons in the house? Are there handguns in the house? Where are the knives in the kitchen? This is so ingrained in this kind of emotional, physical, medical, social, religious, cultural notions. This is so embedded in our society and ultimately embedded in our identity as women, that we have to be aware of this. We have to be aware of this for us and for other people, for family members, for friends close to us.
Yeah. And I think when it comes to, I mean, I feel like you beautifully through and through our whole like talk described exactly what it means to be an ally. I think one of the biggest takeaways I got from this is that really to listen and not to be quick, to not have your knee jerk be to give advice. A lot of times it's just like, even if it's just passively listening to the survivor that's in front of you, that I think is like so critical. And like honestly, in like medical practice, I feel like so rarely do we truly like end up listening to our patients, because we kind of walk into a situation and like even before our patient says anything, we convinced ourselves that we know exactly what's going on. But there are so many times that, especially when it comes to like nuanced cases of domestic violence, that it is truly challenging, and it's everywhere. Like my main line of work right now is surgery, and I'll tell you, and I'm not sure if you've experienced this, but like sometimes some of my patients who like wake up from surgery or like are immediately getting the general anesthesia reversed, they act like somebody assaulted them. Like they will try to hurt literally anyone in front of them. And then when you dig deeper, you discover they have a history of PTSD, almost always involving another partner, or sexual assault when they were a child or when they were older. And it's like, you would have never, I mean, why I would have never thought to ask her about sexual or like sexual abuse history, because I'm her surgeon. So I'm not thinking about that. But then seeing these like strongly atypical reactions, like there are signs. And I feel like survivors like give us, not just doctors, like everybody, they drop hints and they drop signs all the time. And I think that, right, like in order to be a good ally, it's good to listen and to be mindful of these signs. Would you agree? It's hard, but
there are signs everywhere, and the more that we learn to recognize our own biases and what we grew up learning about culture, about religion, about the world that we live in, as we sort of start to unravel those biases, then will we be able to really open our eyes to what's happening around us, and see those signs more clearly.
yeah.
And as physicians,
Right.
like,
And I think like not to like beat a dead horse, but it's just more of like I feel like physicians and also so many of our community members in her will, we are like influential people, right? Like we can just, there's so many things that we can say that people will just like believe, right? And so that's why therein lies your responsibility to be, responsible when it comes to the information that you spread. So I just feel like we are in such a place of privilege to be able to say all of this. So I think it's like super important that when like super egregious, like heinous, like acts of sexual assault like that, like really so sad story about that girl in India, the bus rape, like situations like that. I feel like we need to see it, and we need to like do exactly what you and I are doing, is calling it a medical issue, bringing attention to it, and then telling everybody that, look, like we're physicians, we know the like medical, physical ramifications of all of this. You have to take this seriously. And it's not just physicians, but all of us here who have like who are in places of power, because I think that so many times, and I mean, correct me if I'm wrong, but like I have colleagues who just are so shy and reticent to talk about this. One, maybe because like it's a tough issue to talk about, but the other is just that they're so nervous about like their own reputation. And I understand that, but I think that like it's damaging. If you don't say something, it's damaging, and the cycle continues. So
Yeah.
it's really tough.
Yes, it's important to keep in mind that it's tough to talk about and it's even tougher to experience. So, coming from a place of privilege and recognizing that privilege, and recognizing the responsibility that comes with this privilege to speak out for those people who don't have these voices, who are going through these, it is one of the most important things that we do in our lives.
Yeah. I'm so glad. I'm so glad, Dr. Huck, that we got to talk about this. Clearly it brought out emotions in me that I didn't even realize I had. And I learned a lot. Like I learned so much. This was extremely like helpful, not just for me in my practice, but just like for me, and in ways like allowed me to like be more introspective in ways that I've handled like stories of intimate partner violence that were told to me, not in a patient physician like context, but just like from friends. And I think that that's really important. Thank you.
I agree completely. Thank you.
Yeah. Well, we really hope that, I know that this was a very tough topic that Dr. Huck and I attempted to dissect, and we are happy to readdress it at any times. Of course, nothing that we said today will count as actual medical advice, but the whole reason, one of the biggest reasons that we're talking about this, or we talked about this tonight, is so we can empower you all to talk about this, especially with your physicians. And even if initially you get some kind of pushback because this is a tough topic, eventually someone will listen.
Yes.
Anything else you'd like to add, Dr. Hawk?
No, just to reiterate that there are people out there to help you. We are here for you. And sometimes it might feel hopeless and it might feel like there's nowhere to turn to, but we are here. There are people. We are working on it. We are trying to change this, and we want to create a safer environment for you.
Yeah. Thank you all for joining us, and Asha Kori, we'll see you soon. Thank you.
Thanks.